we estimate 14.9 million excess deaths associated with the COVID-19 pandemic by 31 December of 2021. So this estimate ranges from 13.3 million to 16.6 million. There were 5.4 million reported COVID-19 deaths to WHO over this period. So this excess estimate represents 9.5 million more deaths, or 2.75 times more deaths than reported.
Well, let's get more with Oksana Pyzik. She's a global health advisor and a lecturer at University College London. She joins us now from London. Thank you so much for your time. Firstly, this new estimate, 15 million, it's more than double than the reported official toll that most people have been quoting so far. Tell us more about why this figure has been revised up so dramatically.
Absolutely. During the pandemic itself, it has been very challenging to be able to even track the number of cases. In many countries, there just simply wasn't the resource to be able to do that. So many of these deaths would have gone without actually having either the testing capacity or other healthcare workers and resources around them to enable that. The beauty of why comparing it to excess deaths in the future is looking back at it now is so useful is because it can then account for what it would have been the normal death toll in any other given year and how much different it is during 2020 and 2021.
Okay, now we also know that even with these new revised figures, it probably doesn't account for all of the deaths that were reported, especially in poorer countries, poorer communities. So do you imagine that the real figure is in fact even higher than 15 million?
There is a very likely it's going to be higher than that. And again, this has to do with even just documentation of individuals in low-income countries. You know, people are born, people and die, and there's still no record of that, and in degrees that would be shocking to others. So, for a whole host of reasons, it's probably even higher than these WHO estimates have attributed for either direct COVID-19 deaths, or also people who were unable to get medical care during that time because of the healthcare systems being just so overwhelmed, where even turning into field hospitals, having morgues spill out onto streets, all of this, we saw those really harrowing images coming out of India, and 4.7 million people WHO estimates died of COVID-19 related issues in India, which is about 10 times higher than the official reports from the country itself.
That's right. Oksana Pyzik, we will have to leave it there, but we really appreciate your analysis. Thank you for joining us.